After Connecticut's Ebola scare, you may be asking if our hospitals here in Massachusetts are prepared for the possibility of taking care of a patient with Ebola. 22 News reporter David McKay is live in the studio with the preparations and precautions being taken.
The Ebola virus has been the topic of discussion in local hospital hallways for several months now, and more is being done now that there are recent developments with the virus.
The Centers for Disease Control and Department of Public Health have been assessing protocols followed in Texas, where 2 nurses contracted the Ebola virus from an infected patient. So proper precautions are taken throughout the nation, but some are not reassured.
I don't think people are taking it seriously as it is. I think that they should do more about it.
Bay State Medical Center says they are well prepared.
We are prepared.
Screenings for patients walking into Bay State Medical Center have been stepped up over the past several weeks, and the CDC and DPH have also been modifying the tools and resources available to healthcare workers.
Dr. Sarah Hessler of the Bay State Medical Center Infectious Disease Division says they are focusing on the removal of protective gear.
Using a special fluorescent gel that we contaminate the person with, and then we have an assistant that helps them to get out of the personal protective equipment. Then we use a black light to see whether or not they got any of the gel on themselves.
Hessler told 22 News that it helps them know if they remove the equipment correctly. So if they have to deal with an Ebola patient, their healthcare workers will be protected.
There are 4 biocontainment hospitals in the U.S., and the closest is Emory and Nebraska, which have been sharing information with other hospitals. Live in the studio, David McKay, 22 News.